This is Gene Gray reporting live from Assembly Hall. Today I'm going to talk to you about STIs and how they affect men's health. The U.S. has the highest rate of STIs in the industrialized nations. By age 24, 1 in 4 Americans has contracted an STI. 65 million Americans are living with an incurable STI today, and STIs are most commonly reported infectious disease in America. Now, with a few more people and a little bit more information about STIs and specific ones, we'll go out to our ground crew. Our first person is Catherine, and she's going to talk to us about gonorrhea. How you doing, Catherine?
I'm doing well, thanks, Gene. Today I'm going to talk to you about gonorrhea. Gonorrhea is a bacterial sexually transmitted infection. It is also called the clap or drip. Sometimes it's asymptomatic, but other times it does include some signs and symptoms, such as burning while urination, painful or swollen testicles, greenish yellow or white discharge coming from the penis, or burning in the throat or swollen glands, which comes with oral sex. It is most common in men between the age of 20 and 24. You can get gonorrhea from oral, anal, or vaginal sex. To test for gonorrhea, a urine test can be done most of the time, or sometimes a swab can be used to collect a sample from a man's urethra. Gonorrhea is treated with antibiotics, but if it's not treated, it can cause some serious and permanent health issues. Thank you so much, and have a good day.
Thank you, Catherine. Next we have reporting to us is Jesse on syphilis. How you doing, Jesse?
Doing good, Gene. Syphilis is a bacterial STI that is contracted through all forms of sex. Primary or secondary syphilis has the symptoms of sores or rashes. After about a year, if it's untreated, those symptoms will go away, and then in about 10 years, they'll resurface in latent syphilis as numbness, paralysis, dementia, and in some cases even death after extreme internal organ damage. My advice to reduce the risk of contracting syphilis is to abstain, or if you're going to be sexually active, use a condom and be a part of a mutually monogamous relationship.
Next, we have Nico, and he's going to be reporting to us about genital herpes. How you doing, Nico?
Genital herpes is a common STI where most people who have contracted the virus don't know that they have it because they don't show any symptoms. It is caused by two types of viruses, herpes simplex type 1 and type 2. It is very common and you can contract it through any type of sexual activity. Sores consist of one or more blisters around the mouth, rectum, or genitals, and there's also different types of breaks in the skin. Other symptoms include flu-like symptoms, repeated outbreaks, unusual sores, smelly discharge, burning urination, and for women bleeding between periods. There is no cure for genital herpes, and it can be very severe for those with suppressed immune systems. However, there are medicines that help shorten outbreaks.
All right, thanks, Nico. And finally, we have Kyle, and he's going to be reporting to us about chlamydia. How you doing, Kyle?
Chlamydia is a bacterial, sexually transmitted infection that can affect both men and women. It is the most common STI in the U.S. If left untreated, chlamydia can make it difficult for women to get pregnant because of the permanent damage it can do to a woman's reproductive system. It can cause male infertility as well. Symptoms in men include discharge from the penis, burning urination, or pain and swelling in the testes. Chlamydia can be avoided by abstaining from sex, using a condom, or being in a long-term monogamous relationship with a partner who has been tested and has negative STI results.
Thanks, Kyle. That about wraps it up from our investigating team. So as we've seen today, we have learned that that's why you should always practice safe sex, and so you can cut down on your chances of contracting an STI or also spreading one to someone else. That wraps it up from our Men's Health News team, and we'll be out to see you another day.